Fairfax. And we are recording this session today. It will be available on our website, and we'll also be sharing a link with everyone who registered, as well as the resources. Accessibility really touches upon all of our service areas, and we have been very focused, as have many of you, especially over the past few years, on diversity, inclusion, equity, and access. And we're very excited to be able to offer this accessibility workshop today with one of our staff members, who is actually the first accessibility officer on the staff at ArtsFairfax. And we've been so fortunate to have her expertise, and she's been attending these LEAD conferences and bringing back really important information to us so that we can do a better job of making all of our programs and services more accessible to the community. And we're happy that she's able to share her knowledge with you here today. So without further ado, I'm going to turn it over to Hope Cagle, and she will tell you a little bit more about her background as well, and then get started.
Thank you, Lisa. Hi, everyone. My name is Hope Cagle. I am a white woman in my 30s. I have brown hair, and I'm wearing a pink shirt, and I have snake earrings because they terrify me, and I try to do one thing a day that scares me. I am the education manager and accessibility officer for ArtsFairfax. My access journey started when I worked in a children's museum in Raleigh, North Carolina, and designed hands-on art experiences for children and families. And we catered to a very wide demographic, and that included children and visitors with disabilities. So I had to learn a lot about universal design, and was kind of thrown into this world of access, and I never left because it's for everyone. I was asked to be part of a learning cohort that focused on access in cultural institutions, and the culmination of that cohort was attending LEAD together. This really promoted more cross-sector collaboration, and it was an effort to better equip the city's cultural institutions with the knowledge and tools to improve access. I have my master's in arts management, and I focused on education primarily throughout my time at American. And now that you know a little bit more about us, I would like to know more about you. So I want to know what kind of organization you're from. So if you're visual arts, performing arts, community organization, or if you are not affiliated with the arts, or if you're an individual artist. Goody, performing arts. Great. So a lot of people are from performing arts organizations, which is wonderful. So first, I'm going to talk a little bit about what LEAD is. LEAD is the Kennedy Center's Leadership Exchange in Arts and Disability Conference, and it brings experienced and new professionals together to explore practical methods for implementing accessibility in cultural environments. It's all about resource and knowledge sharing and developing best practices and offering a chance to see accessibility in action. This year's conference was held in Boston, and next year's conference will be in Seattle. And LEAD is great because it really is for everybody. Whether you're an expert or a beginner, it always covers a wide range of topics and information, and topics change from year to year, but there's always introductory sessions, and a lot of opportunities to connect with other people. Some of the best resources I have found about access have come from LEAD. Today, we are going to cover an overview about what access is, information about the ADA, language, plans, training, and partnerships. And then we will have a group discussion about real life scenarios followed by a Q&A. We have a lot to cover, so I will try to get through it all. Um, So whenever we speak about accessibility, the word equity is always involved. And I really love this graphic because it clearly illustrates what equity looks like. Instead of people being given the exact same resource, each individual's needs are met and they have the intended experience. Now I want to know how familiar everyone is with accessibility. There we go. Great. Wow. So we have some people who are beginners, a few more who are familiar, and lots that are experienced. Fantastic. So for those who are beginners, I'm just going to share what accessibility is. It is the concept of whether a product or a service can be used or experienced by everyone however they encounter it. Um, and access by numbers, up to 1 in 4 adults in the US have some type of disability. 12.1% of adults have a mobility disability. 12.8% of adults have a cognition disability. 6.1% of adults are deaf or have serious difficulty hearing, and 4.8% of adults have a vision disability. Disability is the most underreported community in the arts and entertainment industry. Fewer than 2% of characters on TV are disabled, and 95% of those characters are played by non-disabled actors. And this is referred to as disability drag. Usually I associate the word drag with lots of fun, colorful things, but this is not a good thing. Casting able-bodied actors in the roles of characters with disabilities, not good. And disability is the only category of diversity that anyone can join at any time. According to the US Census Bureau projections, in 2030, people 65 years and older will outnumber children. So with a growing elderly population, that means that disabilities will probably increase in the United States. Next is language. Language is something a lot of people are unsure about. It's very, very important. Consistency is key. Make sure that if you have a website, that if you're offering services to the disability community, don't go from saying visitors who are disabled to the disabled. Use the same phrases. And be sensitive about words like disorder, impairment. The word condition can usually be a good substitute, but there's it's a really, really tricky turf. And the best thing is to remember that lots of disability language has been coined by not disabled people. Definitely avoid words that are made up, like diversability and differently abled and handicapable. The term disability is fine. It's widely accepted. And unless someone corrects you, it's fine to use. And person first language is widely accepted. So person first language is saying someone who uses a wheelchair, a person who uses a wheelchair, instead of saying a wheelchair user or a person who is blind or low vision, not a blind person. So it's putting the person before the disability, because disability is more than a diagnosis. It is a lived experience. It is diverse and intersectional, and it is the one community that anyone can join at any time. Um, so what can access in the arts look like? It can look like a lot of things, as you see here. It can look like representation in performances, ASL interpretation, 3D printed tactile works, or tactile tours if your organization is equipped for it. Comp tickets for companions, audio description, captioning, and this doesn't have to be real-time cart captioning. You can create a PowerPoint of the lines of a show and project them onto the stage if you have a screen. Just make sure that you ask the captioning rights from licensing companies. It can also look like a quiet room or a chill out room. Large print maps of your space, specific times you're only open to visitors with disabilities. And one thing I really love is the Cincinnati Museum. Let me pull up their access accommodations. So they have all of their accommodations listed on their website, and they have social narratives, which are a um, growing practice for a lot of arts and culture organizations. So a social narrative is uh, it's a way to show guests exactly what will happen when they visit your space. It might be a series of videos on your website showing a person walking through and experiencing the space. It might be a picture guide with narration of what to expect. Just keep in mind that the visitor's experience starts with their decision to visit, and that might be buying a ticket to a performance, seeing an ad for an exhibit, or viewing your website for more information. Social narratives can especially help ease anxiety about the unknown. So, what will the parking situation be like? How do I get inside? How far will it be from the parking lot? Am I going to have to talk to people? Will it be crowded when I visit? So the Cincinnati Art Museum does a really good job of showing what a good social narrative can look like. So it talks in the first person. It lays out the ground rules. It shows icons. And normally there might be something that says this is a quiet space. Well, this is a quiet space that specifically calls out chill down rooms. Um, so starting with the first thing that people will see, um, showing alternate forms of getting into the museum, showing the ticketing guest, talking about having to check your bag or go through metal detectors, um, going to the welcome desk, talking to visitors, visitor services, getting a map, and their map is really great. It's large print. And then they also have sensory kits. So a sensory kit might include headphones or a weighted vest. It could include a picture schedule, sensory fidget toys, etc. And they have sensory, or they have social narratives for um, the beginning of the visit and during the visit and then leaving the museum. So sensory friendly or relaxed performances, something that someone asked me to speak about today. These performances are usually targeted towards visitors with cognitive or intellectual disabilities. So the house lights are normally left on and the sound is turned down. I've seen this referred to as lights up, sound down. And producers might also take out jarring noises or flashing lights. So talking and movement is permitted. Fidget toys might be provided. It's just a really safe space for everyone to experience a performance without being judged by other people. And more I've seen performing arts embrace a pre-show talk with audiences. There was one with The Lion King that was really well done. The cast members come out in costume and explain that they are actors, that they are wearing costumes. They introduce Scar as the villain, but they say, we know that villains are bad. This actor himself is not actually bad, but for the purposes of this story, we're going to pretend that he's bad. Um, and then they might go through some of the more thematic elements of the show if there's something scary, just to make sure that everyone understands what to expect and that it's okay to shout if you're scared or excited about something. And then some performing arts groups actually invite audience members up on stage to explore the sets and see the costumes up close and touch them. And this is just a better way to understand the story and help them enjoy it more. So the ADA, the Americans with Disabilities Act, was passed in 1990, and it prohibits the discrimination against people with disabilities in several areas, including employment, transportation, public accommodations, communications, and access to state and local governments, programs, and services. And it is based on Section 504 of the Rehabilitation Act of 1973. And it applies to you. Just assume that it applies to you. It applies if you receive federal funds directly, or if they pass through another entity, such as a state or local government, or if you're part of a larger organization that receives federal funds, even if your program is not a direct recipient of those funds. So ArtsFairfax is not a government organization, but we do receive government funding. So if you are one of our grantees, this applies to you. So the ADA says that you must provide reasonable accommodations unless it would cause undue hardship. So an example, when I worked in the Kids Museum, we had a visitor whose mother was blind, and she requested someone to guide her around the museum. And we did this for about a week, but they wanted to visit every single day. And it turned out that pulling one person off of the floor to guide her ended up being an undue hardship because we did not have the staff to accommodate that. Um, and it also includes places of public accommodation, such as places that serve food or drinks, or places that exhibit or have entertainment, places of public gathering, service establishments, places of public display or collection, places of recreation, places of education, social service centers. And then the web content accessibility guidelines are kind of tricky because accessible technology is a growing industry, and there are lots of organizations that specialize in helping nonprofits make sure that they are compliant with these web accessibility guidelines. ArtsFairfax actually met with one of the organizations. They're called Abler, ABLR. And they have people who actually test out your website, use a screen reader with it. And by the end of the session, I received a list of things that I needed to give to my web developer to make the website more accessible. And she knew exactly what to do with it. It was really helpful. And this happened at LEAD, another example of really great resource that happened through LEAD. All right, so accessibility assessments. A couple of people said that they had done an accessibility assessment, but I just want to see how many have. Okay, majority of people have not. So, an accessibility assessment will assist your organization with an evaluation of your ADA policies and services, um, regarding the ADA. And if you identify any major problems with any of these, a person who is knowledgeable and accessibility compliant should be engaged to help you comply with building codes and ADA legal requirements. And working with an expert in the field offers a deeper understanding of these areas of noncompliance, and can help your organization comply not only with the letter of the law, but the spirit of the law as well. Um, the New Jersey Theater Alliance has a really, really great tool. I will send this to everyone after this. It's very long. It's 94 pages, but um, it's probably the best self-assessment I've ever seen, because with every single thing that it asks, it gives you guidance about why that particular thing is important. Um, so do you have an accessibility advisory committee? Um, yes, no, why should I have this? Right here. Um, Again, it's long, but it's very, very helpful and shows you exactly what you might need to work on. So user experts, having a user expert is extremely important because they have the lived experience of having a disability. So there are primary user experts and secondary user experts. So a secondary user expert might be someone who assists someone with a disability, or a family member or friend of someone with a disability who can talk about accessibility and anticipate what someone might need or experience in context. Uh, so most assessments are one facilitator, one note taker, and a group of user experts. And it doesn't give significant data, but it does give design information. And then one thing that I was introduced to at LEAD last year was the concept of creating an energy map, which I find really interesting because it can show how many steps it takes to get from space to space, where seating areas are, how many stairs one might have to climb, which areas are going to be the most crowded. That's really, really helpful, honestly, for anybody. I want to know if it's going to be super crowded if I go somewhere. Um, so an assessment needs to start with the very, very beginning of the user experience. So that might be the online ticketing process, which if you're doing one of these, go through it with user experts over Zoom, and you can cancel out the ticket at the end, or you can have that be part of their comp. You need to make sure that you are paying user experts. Very, very important. It can be a small amount, a $50 honorarium for a maximum of 2 hours, or include the performance as part of this. Um, and it needs to be diverse in all ways, and you need to have different groups. So that cuts down on the possibility of influencing each other. And then it needs to happen when your organization is open, and held on a normal day of the week. It can't be a simulation because you need to know what happens in real time. Uh, Next, we have staff and volunteer training, which is very important. I know a lot of the organizations that we work with are primarily volunteer run, but it is incredibly important that everyone is familiar with your accessibility policies and standards, and that you're creating an environment that encourages asking questions. So highlight challenges during trainings, so people know what to expect and how to address them. Um, Create a front of house survival guide. Have uh, hands-on 5 to 10 minute trainings in which you go through things like how to work an accessible door, how to change the batteries of an assisted listening device. So having variety in the types of training and the frequency is really important. And you really have to train from the top down. So starting with your board and senior leadership. Um, and your policy and guiding principles need to be put into words. Um, the policy needs to be inclusive for every person, and you should reach out to the community and ask for feedback. Um, and then um, show your staff or volunteers the extra effort, how it will be noticed, call out successes, and remember that a great interaction can turn into an unexpected funding source. Um, be honest and let staff know that it takes mindfulness and sometimes extra effort, and make it personal. It's important to train staff to care and teach them the difference between sympathy and empathy. And definitely document your trainings. Um, so partnerships, advisory groups, and affinity groups. Advisory groups can be a group of user experts. And they can also be shared between organizations. This is something that we talked about at LEAD a lot this year, was organizations sharing a group of people who help with their accessibility needs, who provide guidance on their policies, help identify goals. Um, and partnerships can also come in handy here. For example, um, ArtsFairfax is part of something called the Northern Virginia Local Arts Agencies, which is Fairfax, Arlington, and Alexandria, and we group up and provide professional development training for arts organizations in the area to cut down on costs and to reach more people. This can be done with an advisory group too. An affinity group can be allies and advocates. It doesn't have to be a high commitment, it can be online. It just offers a safe space to ask questions and share information and ideas. One thing that you have access to when you go to LEAD is you are signed up for the VSA network for a year. It's part of the registration. Um, It's really, really interesting because it's all different cultural organizations who are asking each other questions. It can be as simple as, has anyone used Gala Pro? I'm having trouble with my captioning service. Does anyone have any suggestions? To does anyone have a good training resource for seasonal volunteers? Or does anyone have an emergency plan that addresses specifically visitors with disabilities? Um, and everyone is just so free and open with information. I highly recommend it. Um, it is not that expensive, and it's a yearly thing. So organizations can sign up for 5 members, and you also get a conference discount. Um, and individuals, it's just $30 per year. And you have access to webinars and job postings, and it's just a really great networking tool. I highly recommend. Um, so partnerships. An example of a great partnership might be a performing arts center and a performing arts organization that uses their space. So making sure that there is cohesion with accessibility. How do you make sure that you are maintaining accessibility in a space that is not your own? The answer is an accessibility writer. I know that if you're from a performing arts organization, you probably have a technical writer, or you're familiar with the concept of having a technical writer. An accessibility writer just is the same thing, but for access. And I have an example. Um, for some reason, when you search for accessibility writers, a lot of organizations from the UK have information about access writers. This one is from the UK. Um, so it has definitions, information about travel, um, meeting and rehearsal spaces, travel needs, costs. Um, yeah, and I will send this as well, along with everything else. Um, and there we go. So we are going to go through some real life scenarios, some discussions about things that have actually happened and how you might address them. Um, so the first one is a patron who uses an oxygen tank has come to a performance. A patron sitting near them complains to your house manager about the noise. What do you do? Please enter your responses in the chat. Anyone? And yes, all of these tools will also be on the ArtsFairfax website. The correct response is to move the person who's complaining. It's if they have a problem with it, that's their problem. Don't move the person who needs an oxygen tank. Um, they're just trying to enjoy the performance. Scenario 2, patron called ahead to your organization to make sure that their scooter would be admitted into your gallery. They were told yes, but upon arrival, a volunteer greets them and tells them that it isn't admitted. The patron leaves. What do you do? You can grovel, apologize profusely to the patron, and give them direct steps that you are going to take to ensure better staff and volunteer training. Make sure that there is a line of communication, an unbroken line of communication when it comes to people with disabilities who are visiting your space. If someone calls ahead and says, "Hey, I need to bring this mobility device, is it allowed?" You would say yes, and I will be there or someone will be there to greet you. That makes such an impact and it's incredibly important. Um, and during the pandemic, there was someone who wrote an article about all of the apology letters that he's gotten from various organizations when he asked about closed captioning. And they are it's a very, very wide range of responses that he received. I will send that to everyone as well. It's a very interesting read. But the important thing is make sure that you're actually taking steps to remedy these situations. Um, all right, and you lease out a performing space that doesn't have wheelchair seating. What are your options? I talked about an accessibility rider. That is a really great option for saying, hey, this is what we need to perform in this space. And in terms of wheelchair seating or companion seating, taking out seats is an option. Um, having better seating for people who use wheelchairs or their companions is also a really great thing to have. Um, and someone brings a dog that they claim is a service animal, but the dog misbehaves and barks at other patrons. What do you do? This one is tricky. Does anyone want to respond? There are things you can and cannot do when it comes to service animals. So quiet. Okay. Legally, you are allowed to ask if the dog is a service animal required because of a disability and um, what work or task has the dog been trained to perform. So staff are not allowed to request any documentation for the dog. require that the dog demonstrates its task, not allowed to do that, and you're not allowed to inquire about the nature of the person's disability. Um, and then if a service animal is acting up, barking, just like people, animals can have bad days. Um, you can ask them to leave. Um, if it is completely disrupting your services, you can absolutely ask them to leave. If the person says that it is an emotional support dog or an emotional support animal, that is not covered by the ADA. Um, oh, and someone had a question about allergies, people with allergies. If someone sees that a dog is there and they know that they have an allergy, and that dog is clearly a working dog, that person can move to another part of your space. In places like dorms where people are pretty close to each other, you might move a person who has an allergy to a different dorm to make sure that they don't have any kind of reaction. But just making sure that everyone has as good an experience as they can while making sure that everything is accessible. All right, now we're gonna have a Q&A. So if anyone has any questions, please enter them either in the Q&A or in the chat. Fantastic. Everyone knows everything already. It's great. Okay, well, if you do have any questions, you can go to the resource page on the ArtsFairfax website, which I will show you. It's very easy to find. Oh no! We do have a resource website, a resource page on our website. Um, it was taking too long to respond, so sorry. And it is, share my screen. So we have information about advocacy, arts and economy, education, arts and health, creative placemaking, and DEIA. Oh, one thing I forgot to mention was that if you have an access statement, please put it in the chat. Your access statement might be part of your DEIA statement. Arts Fairfax has a DEIA statement, which includes access. It doesn't have to be a separate thing. So our access resources are split up into websites, webinars, articles, assessments, and reports. And all of the resources that I gave today will be added to this page afterwards. All right. Are there any other questions?
Oh, thank you so much. That was really, really amazing overview. I learned so much, and we really appreciate all the information that you shared with us today.
Absolutely. Someone did have a question. Is there a list of organizations that work with people with disabilities in the county? There is not a list, but there are several organizations that do that I can add to this page. One is, I actually learned about this one at LEAD this year. It's called Washington Ear. They're a group of volunteers who do audio description for organizations in the DMV. Um, And there are lots of organizations like that that are volunteer run that just want to help you with access. So I will compile a list of the ones that I know of. And also, another example of a partnership is ArtsFairfax partnered with the Park Authority for our Poet Laureates Community Engagement Project. And I found that the park has a very, very good access program, and any program that we had on park grounds, we were able to request an ASL interpreter for free. So knowing who has that kind of budget and resources is really important. Um, we're also able to request the same interpreter every time because she themes her outfits and earrings to whatever we're doing. Fantastic. All right. Okay, well, thank you all so much for joining today. Again, this has been recorded, so you will all get a link to the video later today and resources, all of the resources and assessments that I talked about today. Um, all right. Thank you so much.
Thank you.